Yeah, my name's Peter Boone. I have CHM. I'm 28. I'm 28. Yeah, I found out about the Research Foundation probably a little before the Philadelphia conference. So I just went to that one and was like just really interested in meeting people. So I'm here to like kind of meet other people, talk to guys who have this disease, and really kind of figure out like how they deal with it, and talk about my own struggles with it, and just kind of learn and yeah, I don't know, connect. So I knew my uncle. Yeah, he had the disease. They thought it was RP. So at some point I got tested. Like the doctor noticed something was wrong with my eyes when I was young. So um, even my parents knew when I was, I don't know, 8, and then they told me different things over the years. I started to learn more and more about it. My background's in molecular biology. Like I did undergrad in that, and then worked in a lab for a few years. And so while they sent my sample out to get it tested, I also did a little bit of work on my own and like figured out what my own mutation was. So yeah, I don't know, just like super interested in that. So um, yeah, got involved more on the research side of things with the CRF. So I've been going to some of the research conferences and just like learning more about the disease and trying to write things about it and share things with other people. So yeah, that's it's super great to meet other people who have it. It makes the disease less theoretical, and it gives and lets me see what the disease is actually like, and sort of grounds any anxieties I have about the future. It makes me see that people live with this disease. There's a wide variety of how it affects people, and people are able to cope with it and thrive with it. So just really putting a face to the disease, and realizing that it's not just me, that there are a lot of other people who have this, who deal with it. That's the real big thing I've taken away. Yeah, it's I think it's like a super important thing. It's a super important part of coming to terms with the disease. I know some people have families, and so they can kind of put a face to the disease, but particularly if you don't know anyone else who has this disease, it's so rare. You'll try and talk to your friends about it, and they'll be like, okay, cool, like that's interesting. But you come here and you talk with people, and everyone has the same story. Everyone's bumping into coffee tables. Everyone's knocking things over. So there's just a real kind of camaraderie, and you don't have to spend 30 seconds or 2 minutes explaining the disease. Everyone lives it and they understand it. So it's just like the connections that you have because you've shared those experiences are really cool. Yeah, as someone who studied molecular biology, I'm hopeful about what the work that's being done, and I'm also cautious. It's a scary thing. Like any sort of therapeutics is, um, that's you do have things to lose, but there's a lot of hope. Yeah, in the research that's being done. And it's very encouraging to see all of the work that's being done. Yeah, it's an interesting thing. I think some of that's historical. That fact that we have this disease that when you look at in someone's eye, you can tell the disease they have, and it is only linked to one gene. So there's kind of a bit of a history there where it's scientists were able to just study that one specific disease and develop specific therapies. So yeah, I think the fact that it's kind of rare and is you're able to distinguish it from other diseases made it a good target for those gene therapy trials. So we're definitely, I think, we're a little bit lucky that we have this disease and that we have it in the eye, because the eye is a great place to study. It's a it's a lot of advantages to the eye. So yeah, I don't know. It's an interesting. I think we've really benefited from just kind of being a unique disease. It's yeah, kind of easy to study. I've participated in some natural history studies, so I've been in a couple studies. It's always fun to like read through the paper and be like, oh, I'm patient 17. Yeah, it's always like great to be involved in those. I think the therapies just like wasn't the right time. Just wasn't kind of confident. Sort of wanted to see it play out a little bit because it's a tough decision. You've gotta weigh sort of the vision you have and the if you wait too long, the vision you'll lose. So it's yeah, it's a tough thing to decide. Being part of the research committee has been very cool. It's a really unique opportunity to kind of talk with researchers and ask them a bunch of questions and review what they're doing and learn more about it. So that's the fact that the foundation kind of opens up that opportunity is super cool and something I'm very grateful for. So yeah, I just and then kind of just the people, just sort of after 3 conferences, just keep coming back, seeing familiar faces. It's yeah, it's very cool to kind of continue to get to know everyone here. Yeah, obviously, the more funding we get, the more we can fund, and we have yeah, lots of these grants coming in, and we can only choose so many, and yeah, the more money we can get, the better. And I think also the more money we are able to raise, and the more money we're able to show that we have and fund, that brings in more researchers. So the researchers see that this organization's legitimate. They're funding these studies, and so let's send in a grant proposal. So it's kind of there's a snowball effect there. We can fund research strategically so that that can then be picked up by some of these bigger pharma companies and turned into clinical trials. So it's really about finding where the most impact for the kind of least amount of money is. We have to be, you know, um, yeah, frugal.